Okay, so we've both been seeing a lot of talk around these newer weight loss drugs. And you sent over something that, honestly, I hadn't come across.
Right. It's a bit out of left field.
Totally, it's this cosmetic side effect, but it's not the face or, the other areas we've heard about. It's feet.
Feet, exactly. They're calling it Ozempic.
Ozempic feet.
Yeah.
Okay, so the idea is that rapid weight loss from medications like Ozempic Mounjaro, it can cause sagging skin, maybe an older look, but on your feet?
Yeah, it seems to be the latest in that series, Like Ozempic face, Ozempic butt, now this.
Right. So we've got the articles, the briefing docs you flagged. Our mission basically is to figure out what's going on here, the causes, what experts think.
Mm-hmm.
So I guess the big question right off the bat is, how on earth does a weight loss drug end up affecting, well, your feet? Seems kind of weird.
It does seem weird at first glance, doesn't it? But if you think about it in context, it starts to make a bit more sense. Well, think about what we already know. Ozempic face, right? That's losing facial fat, sometimes leading to that gaunt look, sunken eyes, maybe more sagging.
Yeah, the hollowing effect.
Exactly. And Ozempic butt, losing volume there, looking sort of deflated. Ozempic feet is, well, it's basically the same kind of process, just on the feet.
So less fat padding, basically.
Precisely. The skin looks less plump, maybe more wrinkly, a bit older looking. And yeah, it's primarily seen as a cosmetic thing, tied directly to losing fat pretty quickly.
Got it. So purely aesthetics, not like foot function or anything.
Right. That's the understanding so far.
Okay, so let's get into the why, the mechanism. The sources mention a Dr. Barry Weintraub, a plastic surgeon. What's his take on how this actually happens?
Dr. Weintraub's explanation is actually quite interesting. He links the rapid fat loss to how the skin behaves.
Okay.
He points out that when you lose a significant amount of weight, especially with these drugs, it's systemic. You're losing fat reserves all over.
It's just in the obvious places.
Exactly, including the fat pads in your feet. And, those pads naturally thin out a bit as we age anyway.
Oh, right.
So you lose that underlying support, that cushioning fat in the skin. Well, it doesn't have the same structure holding it up. It can lose firmness, look saggy, wrinkled.
Makes sense. Like deflating a cushion a bit.
Sort of, yeah. And he also mentioned something about water retention. A lower BMI, which often comes with this weight loss, can mean less water retention in the tissues.
Okay, and how does that affect the feet?
Well, less water could make the underlying stuff, veins, tendons, even bones a bit more visible. So it's potentially a double whammy, less fat, maybe less hydration in the skin itself.
Right, that paints a clear picture. Less scaffolding, less plumpness. It's not just theoretical, though, is it? This whole discussion seems to have gotten a boost from celebrity examples. Sharon, Osbourne, Oprah Winfrey, they're mentioned specifically.
Yeah, that's often how these things catch public attention, isn't it, when you see it on people in the public eye?
So what happened there?
Well, with Sharon Osbourne, she apparently posted a picture online. Face looks smooth, maybe airbrushed, people thought, but commenters zeroed in on her feet.
Oh, wow. What do they say?
Things like, beautiful photo, but the feet tell your age, or how strange when the skin on your hands and feet doesn't match your face, that kind of thing, noting a contrast.
Ouch. And Oprah.
Similar observations, apparently. At an awards show, the NAACP Image Awards, people noted her feet looked looser, maybe more saggy than expected.
And the connection is they've both used these drugs.
Yes, and they've both been open about it.
Yeah.
Osbourne has talked about using Ozempic, even saying she lost too much weight and stopped. Winfrey discussed using a GLP-1 drug as a tool for weight management.
Okay, so it's not just random speculation. These are people who have confirmed using the medications, and observers are noticing this specific foot appearance. That definitely adds weight to it.
It moves it beyond just, I wonder, and it seems like part of a wider conversation, too.
Yes.
Well, the articles also mention speculation about other celebrities. Christina Aguilera, Katy Perry, Scott Disick, Jessica Simpson. Maybe not specifically about feet, but about Ozempic face. Or just significant rapid weight changes potentially linked to these drugs.
Right, so it's part of this bigger picture of noticeable cosmetic changes happening alongside the weight loss from these medications.
Exactly. It suggests these effects, while maybe cosmetic, are becoming sort of a recognized phenomenon.
And given how many people are actually using these GLP-1 drugs, stats suggest a pretty significant chunk of the U.S. population has tried them.
Absolutely. That's a key point. We're not talking about a niche medication anymore.
So something like Ozempic feet, even if it's just cosmetic, could potentially affect a lot of people, or at least be something a lot of people and their doctors become aware of.
Precisely. It really highlights the need for doctors and patients to have these conversations about the full range of effects, the good, the intended, and maybe the unexpected cosmetic ones, too.
So thinking from that doctor-patient perspective, if someone comes in concerned about this or if a doctor notices it, what can actually be done? Did Dr. Weintraub suggest any solutions?
He did, from a cosmetic angle, of course. He mentioned two main possibilities.
Okay.
One is surgery, something he called a foot lift, which sounds involved. Making incisions, tightening the skin on the sides of the foot.
A foot lift. Wow. Okay.
What else? Something less invasive. He mentioned Skin Vive. It's an injectable based on hyaluronic acid.
Like fillers for the face.
But for feet?
Kind of. It's designed more as a skin plumper to hydrate the skin deeply. He suggested it could help sort of disguise those more prominent bones or tendons that might show up when the fat padding decreases.
Interesting. So camouflage rather than structural change.
Yeah, addressing the appearance. It's important to stress these are cosmetic fixes for aesthetic concerns.
Right, of course. It's interesting, though, looping back to Oprah's comments you mentioned earlier about weight not just being willpower.
Yeah, that quote really struck me too. It feels relevant here. It underscores that these drugs are doing something pretty fundamental biologically.
Exactly. They're not just tricking your brain into feeling full, they're interacting with complex systems in the body, hormones, metabolism.
So seeing a change like Ozempic feet, even if it's just cosmetic, is kind of a visible sign of those deeper physiological shifts happening.
I think that's a really insightful way to put it. It reminds us that these powerful medications can have widespread effects. The main benefits for weight loss for diabetes are obviously huge for many people.
Absolutely.
But it's crucial, really, for everyone involved, patients, doctors, to be aware of the whole picture. All the potential effects, even the ones that seem minor at first glance, like skin changes on your feet.
Okay, so let's try and recap the key points here.
Yeah.
Ozempic feet. It's a cosmetic thing. Sagging or older-looking skin on the feet.
Right, linked to rapid fat loss from GLP-1 drugs.
Probably caused by losing that subcutaneous fat padding, maybe combined with less water retention, making veins and tendons more visible.
And we're seeing it discussed partly because of observations involving celebrities who've used these drugs.
And there are potential cosmetic fixes, like injections or even surgery, for those bothered by the appearance.
That pretty much covers it, and it really does highlight how interconnected everything in the body is. You target one system, and you might see effects elsewhere, sometimes unexpected ones.
Yeah, this whole look at Ozempic feet, it really drives home that interconnectedness, doesn't it? How these powerful drugs can manifest changes in places you wouldn't initially think of.
Definitely.
It kind of makes you wonder, as these medications become even more common, what other subtle effects, or maybe not so subtle ones, might we start noticing? And how does that change things, like how we think about cosmetic procedures or just our understanding of how these drugs really work long term?
That's the big question, isn't it? It's definitely something we'll need to keep learning about, keep observing. It's an evolving picture.